None of us would be where we are today without our past. Our past is important because we live, we learn, and we are shaped into the people we are now. But it all starts with our childhood, probably the most important part of our lives. What we learn as a kid carries us over into adulthood and into almost every aspect of our lives. It is what allows us to grow to be successful.
Sadly, not all babies are able to have a full childhood. Some are only able to live in this world for a few hours, minutes, or even seconds, unable to have the same opportunities as others.
However, a relatively new and very promising field known as fetal surgery is paving the way in operating on fetuses before they are even born.
A fetal surgeon operates on a fetus in an effort to improve and/or treat detrimental and fatal birth defects that could limit the fetus's ability to live. They are responsible for giving consultations, explaining conditions and surgeries, performing a wide variety of surgeries, and checking in on the progress of the mother and baby afterwards. They must have good surgical skill, good communication, and good teamwork skills.
As we mentioned before, fetal surgeons perform various types of surgeries and procedures. The least invasive procedure is needle-based therapy, where they use a needle and an ultrasound to either draw or insert amniotic fluid, provide or sample blood, or place a shunt.
Fetal surgeons also perform fetoscopic surgeries. In this type of surgery, the fetal surgeon makes a small incision in the mother's abdomen and inserts a thin tube with a tiny telescope attached to it, called a fetoscope, into the uterus. They can then see and operate on the tiny fetus.
Another common surgery that fetal surgeons perform are open fetal surgeries. These are where the fetal surgeon makes a large incision into the mother's abdomen and then another large incision into the mother's uterus. To keep the amniotic fluid levels safe, they continuously infuse warm fluids into the uterus. They then operate on the fetus while it is still in utero, close the uterus, and then keep tabs on the mother and fetus to ensure that there are no complications.
Finally, fetal surgeons also perform exit procedures. Exit stands for ex utero intrapartum treatment and is done when the fetal surgeon predicts that there would be a critical problem when the baby is separated from its mother, especially during birth. During this procedure, fetal surgeons use a special device to open the uterus and control bleeding. The baby's head and arms are delivered so the surgeon can operate while the fetus is still attached to the placenta.
Operating on an unborn child and saving their life is a reward like no other. But with the job also comes great responsibility. The work environment can be very stressful, and a lot of schooling is required to get to this position in the first place. While these challenges may appear hard to overcome, it is not impossible.
Being a fetal surgeon means more than just operating on fetuses. It means giving that child a chance to grow up, a chance to be an active member in their generation, and a chance to allow them to flourish. Fetal surgeons are actively changing the world, one surgery at a time.
Thank you.